The 5 professions that suffered the most during COVID-19. The first responders. You're driving with the sirens on. The streets are quieter than usual during lockdown. Dispatch sends you to a possible overdose with reported tension at the scene. You arrive wearing a mask and gloves. You assess the situation, secure the area, and follow department protocol. One person requires immediate medical attention. Another is frustrated about restrictions and raises their voice. You stay focused. You complete the call. You move to the next one. During the COVID-19 pandemic, this type of heightened alertness became routine for many first responders, including police officers, paramedics, and firefighters. Repeated exposure to emergencies, public tension, and health risks meant that stress levels remained consistently elevated for extended periods. Post-pandemic research helps quantify that impact. Research conducted during and after COVID-19 found that around 22% screened positive for probable PTSD, and approximately 19% screened positive for depression. These figures indicate that a measurable portion of emergency personnel continue to experience psychological effects after the peak of the pandemic. The teacher. You're sitting at your kitchen table with the laptop open in front of you. The screen shows a grid of small video windows. Some children are muted. Others look distracted or quietly upset. You're in the middle of explaining a maths concept, trying to keep your voice steady and encouraging, when a new email notification appears from a parent. Why isn't my child progressing as expected? In the next room, you can hear your own child on their Zoom call, going through the same routine, missing the normal school day with friends and teachers in person. You keep the camera smile on, answer questions, give feedback, and try to make the lesson feel structured and supportive. Inside, though, there's a quiet sense that you're stretching yourself thin, trying to be present for your students, responsive to parents, and still a parent at home. The lessons end, but the work doesn't. Assignments to check, messages to reply to, planning for tomorrow. It often stretches into the evening, sometimes past midnight. That rhythm, balancing teaching, parenting, and constant digital connection, was the everyday experience for a large number of teachers during the height of remote learning and for some time after. Studies published in 2025 show that chronic stress and feelings of isolation were frequently reported at levels as high as or higher than in certain medical frontline roles. Screen fatigue from long hours online, ongoing guilt about not meeting everyone's needs, and a lingering background anxiety continue to be commonly described in follow-up research. The cashiers, essential store staff. You're standing behind the register with plexiglass separating you from the customers. The line moves steadily, items scanned, bags packed, receipts handed over. One person coughs without covering their mouth. You notice and naturally shift your weight back a little while continuing to work. Another customer speaks sharply. "It's just a mask. Stop making it difficult." Or something similar about the rules in place at the time. You respond calmly, follow store policy, and keep the interaction moving. Your hands feel dry and rough from repeated sanitizer use throughout the shift. With every new customer approaching the counter, there's a quiet, automatic thought in the background. Is this contact going to be the one that matters? Large workforce surveys conducted between 2021 and 2024 found that 30 to 45% of retail and essential service workers reported clinically significant anxiety symptoms during peak pandemic periods. Approximately 25 to 35% reported moderate to severe depressive symptoms, compared to notably lower averages in many non-essential remote occupations during the same time frame. The healthcare worker. You're in scrubs again. The mask presses into your face. Your ears ache from the straps. The ICU is already full. Monitors blink. Ventilators hum. An alarm cuts through the noise. Another patient, another family asking, is he going to make it? You answer the same way you always do. We're doing everything we can. But inside, your mind won't stop. Did I miss something? Was that enough? What if I bring this home? What if my child gets sick because of me? You haven't slept more than a few hours in days. You wash your hands again and again. And when researchers began measuring what healthcare workers were experiencing during COVID-19, the numbers reflected that strain. Burnout climbed to 40 to 60% among healthcare workers during peak waves. Anxiety affected up to 30 to 50%. Depression ranged from 25 to 45%. And 20 to 30% showed symptoms consistent with PTSD. Multiple follow-up studies found that even after infection rates declined, psychological distress remained elevated compared to pre-pandemic levels. Healthcare workers were significantly more likely to report chronic emotional exhaustion, sleep disturbances, moral injury, increased risk of long-term anxiety disorders. This wasn't temporary stress. It was sustained exposure to life-threatening situations, high mortality, and prolonged uncertainty. And the data shows the psychological impact did not disappear when the crisis slowed. During the pandemic, millions of healthcare workers around the world showed up every single day to help others survive. They stood between fear and hope, between life and uncertainty. And many of them never made it home.